As Nigeria approaches the third wave of COVID-19, the National Primary Healthcare Development Agency advised Nigerians on the need to get vaccinated against COVID-19, as over 98% of the received vaccine in March 2021 has been administered to persons across the 36 states and the FCT, while over 1.4 million persons has received the second phase of the vaccine. The executive director of the agency, while briefing newsmen at Abuja, says there is no case of death directed to COVID-19 vaccination. He also disclosed that the federal government is preparing to commence the second phase by July ending or early August, and the National Primary Healthcare Development Agency has put in place all necessary things in preparation to receive the vaccine.
We did not record any case of death directly associated with COVID-19 vaccination. Accordingly, the country has officially ended the first phase of its strategic COVID-19 vaccination plan and is now preparing to commence the second phase in the next few weeks. We have also received communication about the delivery of the following vaccine shipments in the coming weeks. Firstly, 3,924,000 doses of the Oxford AstraZeneca by the end of July or early August 2021 from the COVAX facility. Secondly, 3,930,910 doses of the Pfizer-BioNTech or Moderna COVID-19 vaccine in August from the COVAX facility. This has been donated by the United States government. Thirdly, 3,577,860 doses of the Pfizer-BioNTech or Moderna COVID-19 vaccine in Q3 from the COVAX facility. Fourthly, 29,850,000 doses of the Johnson & Johnson COVID-19 vaccine procured by the federal government through the African Union. As you may be aware, in the first phase of the vaccination program, no vaccines expired, despite a lot of concern that as a result of vaccine hesitancy, many Nigerians may not be vaccinated. But because of the collaboration and the leadership that the media has shown, a lot of Nigerians came forward despite all of the negative conspiracy theories and accepted the vaccines. This is why we're able to ramp up and finish the vaccines, and we did not have any vaccines expire. As a matter of fact, we do have a batch of the vaccine that was set to expire by July 29th. But you can see how far off from July 29th we are, and as of Friday last week, we already finished the vaccination of Nigerians for the first phase. We now have a lot of Nigerians that are calling and asking for vaccines. As I read earlier, we're expecting vaccines in the next few weeks, and we will be able to address those needs.
We all know that the worst is yet to come, with the third wave continuing to escalate and 15 countries now in resurgence. Nigeria may not meet the criteria for resurgence, at least for now, but with the recent increase in new cases and report of the highly transmittable Delta variant, we are monitoring them closely. However, the needs exist to stress that the Delta variant is dangerous and continuing to evolve and mutate, which require constant evaluation and careful adjustment of the public health response. With Nigerians at precedent during the first and second wave, I'm very confident that we can still blunt the impact of these new infections if everyone, everywhere, plays their part by taking precaution to prevent the transmission.
The pandemic is still here, and we must take measures to ensure that we prevent its further expansion around the country, but also we take the measures to ensure that the next phase of the vaccination campaign is equally successful. As Nigeria stands up in the rest of Africa and in the world as a leader on this vaccination, we must prepare through good social mobilization, through the traditional and religious leaders, through community leaders, to ensure that all people understand the criticality of taking the vaccine and the low risk that it has for it. In the meantime, the preventative non-pharmaceutical measures must be taken, the wearing of masks, the washing of hands, and the socially distancing.
Dorcas Olariwaju, Voicetv, Nigeria.